Hey, welcome back. Today we're going to look at GCS. So we're going to go over our GCS Glascow Coma scale. We have a range of 15 where everything's perfect and a range to 3. No one can be more than a 15, no one can be less than a 3. This pen right here is a 3. All right, we're going to start with 3 different categories. We have our eyes, verbal, and motor. For our eyes, we have 4 categories. The way I like to do it, I like to start at my top and my bottom. For our top with 4, we're going to have all good. That's going to be everything's good. Our patient's able to track us with our eyes. When we come in the room, they're able to look at us, follow us. Everything's normal. So their eyes are tracking. And then down here at our 1, we've got nothing. Their eyes are closed. They don't open them to pain. They don't open them to look at us. They're just closed. No response from their eyes. And then we're going to fill in between. So for our 3, we're going to have our eyes open to verbal stimuli. So we come in, we say, hey, can you hear me? Hey, how's it going? Whatever it is, they're going to open their eyes and they'll track you. For 2, that's going to be our pain. So we come up to our patient, hey, can you hear me? No response. Our next is going to be a painful response. We give that sternum rub, whatever it is. We get the painful response. If our patient can open their eyes to that painful response, they're going to get a 2 on our GCS scale. 4, all good. 3, verbal. 2, pain. 1, closed eyes, no response. Now we're going to move over to our verbal. Verbal is going to be 5 categories. We're going to start with our 5 and move down to our 1. Our 5 is going to be all good. They can obey commands. They're talking to us, they're following us, there's no confusion, everything seems normal. And then down to our 1, where we have nothing. Our patient is not making any sounds, they're not talking to us, they're not moaning, groaning, we've got nothing. And then we're going to fill in between there. 4, 3, 2, and our 1. Our 4, our patient's going to be confused. Something isn't right. There's something off, they don't know where they are, they can't quite figure out what happened. Somewhere in their discussion with you, they're confused. 3 is going to be inappropriate words. So think of your stroke patient where they can't quite get that word that they want. The red fox jumped over the floor where they want to say fence. They just can't quite get that word, that appropriate word in there. Or their words are jumbled. Their words aren't making sense. They've got words, but it's a word salad. It's just not making sense. Inappropriate words. And then 2 is going to be our mumbles, moans, and groans. So this is our incoherent sounds. Our patient isn't making audible word or good words. They're just kind of mumbling, moaning, groaning. Something hurts, but they can't communicate with you. That's our verbal. Our last category is going to be our motor. Our motor has 6 possibilities, 6 and 1. Again, our 6 at the top is all good. Our patient is able to follow our directions, is able to move their limbs in the appropriate direction, appropriate manner, can reach out to shake your hand, can reach out to give you their radial pulse, whatever it is, their motor is all good. And then again, 1 is going to be nothing. Our patient that's laying flat, they can't move, they're not extending, they're just kind of laying unresponsive. And then we're going to fill in those gaps. So we got a 5, 4, 3, and 2. So our 5 is our patient is going to localize any kind of pain. They can tell you where it hurts. They can, if you provide pain to them in a spot, they're able to push your hand away. They can tell where that localized pain is and push it away. So localizes. Our next step down is going to be withdrawals. So this is where we give that pain stimulus to our patient and they move away from it. We give them that sternum rub, they pull away. Withdrawals. Then we're going to have our decorticate or our flexion. So that's where our patient's going to be pulled up. They're going to be in like a fetal position or everything's pulled into the core. And then we're going to have our decerebrate posturing, or also known as extension. So our extension is going to be everything is out, extended. I think the best example to see this is if anybody's watched MMA fights or boxing matches and you see somebody get knocked out, they don't just fall to the floor like a lump mass. They extend and fall over. So that's an example of our decerebrate posturing or extension posturing. And then 1, if we see our patient that's flat on the ground, they're not moving, there's nothing to them. They're unresponsive, they're not flexing, they're not extended, they're just flaccid. That's going to be our GCS. Anything from 15 to 13 is considered mild. Anything from 12 to 9 is considered moderate. And anything 8 or less is considered severe. That's our GCS.